So one of the really nice things about SP.Eye is that we can use a really tiny pack, so we reduce the amount of waste that each injection creates, which, given how many injections are done, makes a huge difference in terms of sustainability for eye clinics and for the entire industry. So a pack with SP.Eye is essentially a galley pot, a couple of pieces of gauze for prepping the adnexer and the eye itself and the device. And the way that I tend to do things, I'll ask my nurse to pour some betadine or chlorhexidine into the galley pot. I'll use a sterile gauze with gloves, obviously, and then clean around the eye, put a drop into the fornix, and I use binoxonate, but oxybuprocaine or tetracaine. And then I'll ask the nurse to drop the sterile pre-filled syringe onto the field. The device itself is really easy to mount because it's on a standard needle. You literally just pick it up and mount it onto the syringe. It's always good to just check that the needle moves freely within the device itself, and then prime in the usual way. You'll find that when you prime the needle, a little bead of fluid presents itself just at the top of the device, and that's quite normal, and then you're ready to inject. When I carry out an injection, I tend to ask the patient to look down. I usually stand at the top. I'll ask the patient to look down, and I'll pull up their top lid using my non-dominant hand, and then I line up the inner curve of the device at the limbus, which automatically places the needle at 4 millimeters, and the foot plate firmly down on the conjunctiva. And then in that position, I know that I'm safe, and I can advance the needle into the eye, and then I can let go with this hand. The needle shaft is protected by the foot plate, so there's no chance of contamination of the needle shaft, and then I can inject my drug into the eye before coming back out again. And that's the injection completed, and then the normal post-injection drop regime that your center likes to use can be started. It's also possible to lock the device to make it sharp safe by squeezing the arms together and displacing it. And so if sharp safety is of concern, or if you're delivering injections out in the community without sharp spins, then you can make the device safe before transporting it back to a center to be disposed of safely. So SP.Eye reduces wastage in intravitreal injection workflows very significantly. This is a traditional pack here, which a lot of centers will be using this or something like it at the moment, with galley pot, cotton wool buds, drapes and speculum. So the total amount of kit in each pack is significant, and that has a bearing also on ETO sterilization, the amount of gas which is used and then vented into the atmosphere. So the smaller you can make a pack, you get exponential gains in terms of sustainability from a sterilization point of view. So one of the lovely things about SP.Eye, and this is an example of a SP.Eye pack here, is that you can get rid of almost everything that you see in the traditional pack. Because you don't need a speculum, because you don't need a caliper, everything is on the needle. So really you're just left with making sure that you've prepared the eye and the adnexer appropriately, which is why we have a galley pot to hold some cleaning solution and some gauze to clean the lid before and after. And then I would usually ask the nurses to drop a minimum of topical anesthesia onto my sterile field, and that's my entire pack. So I tend to find that, having done a list of 20 or 25 injections, I have about half a rubbish bag's amount of waste after that list, as opposed to several bags that you generate very quickly with these larger packs.